Obesity costs our country $150 billion a year. In Ohio, the cost for treating obesity-related illnesses is more than $4.7 billion annually. In the United States, approximately 1 in 3 adults and 1 in 6 children are obese. In Ohio, 3.3 million people are obese, or 28.8% of our population. Here in Marion County, 45.7% of 3rd, 5th, and 9th graders are either overweight or obese. According to the 2012 County Health Rankings, Marion County is among the unhealthiest counties in Ohio, ranking 84th out of 88 counties when it comes to obesity, physical inactivity, tobacco use, teen births, and sexually transmitted diseases. Over the last 20 years, we've watched national obesity rates more than double. In 1990, obesity levels peaked at 14% in some states. By 2010, they surpassed 30% in many states, with no state under 20%. Obesity is epidemic in the United States and a major cause of death attributed to heart disease, cancer, and diabetes. If current trends continue, today's children will live sicker and die sooner than their parents for the first time in American history. Where you live matters when it comes to your health. In Cleveland, Ohio, a recent study indicated that if you live in an inner-city neighborhood, your life expectancy was 64.4 years. In the community of Lyndhurst, just miles away, the life expectancy was 88.8 years. Marion County is surrounded by counties that are healthier, including our neighbor to the south, Delaware County, ranked as the #1 healthiest county in Ohio. The issue of health can no longer be relegated to political discussion. The connection between health, well-being, and economic impact and growth must be realized and incorporated into a broader political and economic agenda for a community to thrive. Now, imagine an entire community pledging to adopt healthy behaviors for themselves and for their families in order to live longer, healthier lives. Imagine a community that becomes happier, healthier, safer, and more connected. Pioneering healthier communities and creating healthy communities are coordinated health movements aimed at making Marion County an amazing place to live by promoting healthy eating and physical activity throughout our communities. Other communities across the state are engaged in the same type of work, and they are making a difference. Communities can expand access to fresh fruits and vegetables through community gardens, produce markets, and expanded convenience store offerings. We can advocate for healthy vending policies, healthy food, and physical education programs in our schools. Local governments can implement traffic safety measures and build sidewalks, crosswalks, and bike paths. Mixed zoning and complete streets can allow easier access to schools, businesses, and grocery stores. Pioneering healthier communities and creating healthy communities are focusing on 6 strategies to make this happen. Strategy number 1, educate our leaders. Developers, school officials, bankers, business owners, and elected officials about the relationship between policy, environment, and community design to positive health outcomes. Strategy 2, expand access to fruits, vegetables, and other healthy foods by increasing available offerings in neighborhood convenience stores and adding produce markets and community gardens. Incorporate the use of neighborhood marketing to ensure that once mechanisms are in place, residents are taking advantage of increased opportunities to live healthier. Strategy 3, support and encourage changes to the built environment to allow for safe, active transportation so biking and walking can ultimately become part of our daily lives. Strategy 4, advocate for and assist with the creation of comprehensive school wellness policies to improve the school health environment. Related objectives include improved nutritional offerings in all areas and increased physical activity opportunities before, during, and after the school day. Strategy 5, advocate for system change in pediatric provider offices to use the most recently updated clinical guidelines to address obesity in the clinical setting. Strategy 6, coordinate efforts relating to tobacco prevention and control, including expanding local treatment options for those wishing to stop smoking. Policy, system, and environment changes are necessary to create opportunities for our community to be healthy and productive. It is possible. Healthy choices are becoming the easy choices in communities around the country, and Marion County is next. Getting involved is simple because the movement has already begun. Success is already being realized. Contact us and get involved. Together we can create a healthier Marion.